in coaching. We had a meeting where they attended. We talked about what we would be doing. And then if they still were interested, then we actually developed a contract with them. The contract that they have are the agencies that you see on the screen. The contract that they have is with Hall County Community Collaborative. Our navigator actually sits with Heartland United Way, but we handle the money. So if we determine that somebody is in need of coaching services, then this referral form is completed and directly taken from the application. We do the reason for referral. That is what we determine is the reason that they need to be referred out. So, and then we look at all of the different areas that they expressed and like having assistance. Can you hold on for just 1 second? My apologies, he was going to eat his lunch at the table. So we directly off the application, we look at if they marked education, employment, housing. Those are all checked so that the coaching agency has an idea what they expressed an interest with. And then the contract with the United Way, this is just kind of a reminder when the referral is sent, what the contract with the United Way has. The contract that they get from these elements are kind of the core services that they have with H3C that are in the formalized contract. And we ask people to connect family with resources, and we'll talk about how they determine that, formulate a plan with the family, utilize family-centered practices, approaches with all community response referrals, identify community partners to connect families to address the goals established in the needs assessment, and we'll go over that in detail. Participate in community coach meetings. I think some of you were able to participate in our meeting on Friday. We do hold those every month. Complete, that's monthly. I'm not sure why that says weekly. We complete monthly summaries and complete the documentation with families. We do ask that all of the documentation that we're going to talk about today, they keep on site. With the exception of the case closure form and the monthly invoices submitted. We ask that they collaborate with other partnering agencies to improve the comprehensive and coordinated approach. When multiple organizations are involved with a family, then they agree to organize and facilitate a team meeting. And they actively participate in the sharing of best practices for the purpose of building community prevention. H3C is relatively new at coaching. We just started this in June, so we are constantly looking for ways to make things better for our families for the ease of supporting the partnering agencies that we work with, but also the families. We reimburse for hours spent on direct client assistance. So this is at $50 per hour. They bill to the quarter of the hour. So the nearest quarter of the hour is what they bill for. We added, I should have pulled up the newer contract. We added, since we started, one of the things that we realized is coaching agencies were doing work and then the family never participated. So we do give basically the equivalent to 1 hour if the coaching agency works with the family or attempts to contact the family and they don't get anywhere, then we do pay them basically 1 hour that they're doing that. We haven't had to use it, but we have also implemented mileage into that to pay for them to go to a coaching visit. And the agency, they may be providing in-kind time to ensure the family's needs are met. What we really strive for is that the coaching, the work with the family is done with the family either present or on the phone. So if they are going to be calling to see who is hiring, they can do that as part of their visit, or it can be homework for the family. But especially if they're doing referrals, we're asking them to have the family, if at all possible, to do that either as part of the visit or on their own. We do cap the time to spend with family to 4 hours per month, and we do 3 months total. There are cases where they could go over the 3-month time frame or the 4 hours per month. We haven't, the 4 hours per month, we haven't really seen that. We have had families that needed more than the 3 months. That is then arranged with the central navigator to extend that. Invoices are completed and sent to the United Way and H3C each month, and we'll talk about as we go through those forms. And then they are paid direct deposit. So the partnering agencies that we have, I process the billing, and they're paid direct deposit, usually within 2 weeks of receiving complete payment and information. Any questions just on the initial kind of where we start? It's pretty basic. Obviously, everybody would have their own contract. Oops, sorry. I'm going to go out of my email. All right. Sorry, apparently have a lot of folders open. All right, so I'm going to pull up. Let me just find the next. Okay. So can you see the screen that I just changed to? You should see the family coach agreement. Okay, this is where I'm going to have to stop sharing and resharing. I'm not very smart on Zoom. Okay, so hopefully now you can see the family coach agreement. So once the referral is made to the coaching agency, then it's kind of out of H3C's hands and it goes into the hands of the provider. And I should have specified. So we have a spreadsheet. We kind of try to equally give to each of the partners that we have. So Jessica will look and say, okay, since Families Care is on, they got, Families Care got the referral last time. So maybe we'll go with building blocks. We also look at, and again, using Families Care as an example, if the agency has a specialty in the services that they provide, then we try to look at that based on the family's needs and then refer accordingly. So we know that Families Care is also a parent connector. So if the family has a middle school child with an emotional, you know, some needs, then we would refer to them because we consider them experts in that field. So then the coaching agency connects with the family, and the first thing that they do is go over this family coach agreement. This is all voluntary. Nobody is required to do coaching. We do have limits to the amount of money that we will spend. So, you know, there are some extra incentives if they participate with a coach, but it is strictly voluntary. It is not something that they have to do. So this is the agreement that they go through, just reminding the families that the goal is for them to be more stable. Most of the families we refer are in a crisis of some kind. And it's really for them to have long-term sustainability. So from the coach's perspective, we want, and not that we would say people don't do that, but from the coach's perspective, they need to treat the family with respect. Contact the family in a timely manner after the referral is made. Promptly return any phone calls or any other inquiries made by the family. Commit to meeting with the family on a weekly or bi-weekly basis. Identify and explain resources available to the family and assist them in the process of connecting with those resources. Help the family develop goals to become more stable and assist the family in developing the skills needed to reach those goals. And this is, the family is seeing that so that the family understands what we're expecting or what they can expect from the coach. Then on the flip side, from the family perspective, we expect the family to treat the coach with respect. to commit to meeting with the coach weekly or biweekly. Face-to-face communication is encouraged, but not always possible. Obviously, during COVID, a lot of the coaching was done virtually just because that was what was available and the safest. Return messages of text from the coach. Communicate with the coach as soon as possible if you need to reschedule. Be willing to communicate needs to the coach. Be open to suggestions from the coach of activities and resources. Realize that funds to help families meet their needs are limited and be willing to contribute for their own resources when they can. We had offered incentives, and prior to January 1st, it was basically incentives were offered solely for participation. That has now changed because what we realized is not as many families were actively participating in the coaching. They were just doing the minimum that they needed to do to get the extra money. So now our new coaching, and if you want, I can go through the incentives that we just put in place. Now it's tied not only to actively participation in the coaching opportunity, but also that they're setting goals and achieving either the goal or some of the action steps along the way. So we can talk about what that looks like. And then for the family also, when community responses meant their needs, to communicate with the coach to schedule a final meeting in order to complete surveys to end services. So the surveys that we use are those that are the Nebraska Children ones. So Denise, you're already familiar with those, and Belinda, I don't know if you're familiar, so those are the surveys that we use. We're not using anything other than what is already available. With the exception of our form. So this is the first meeting, the coach signs this and the family member signs this. And again, just so that it's very clear that it's voluntary and we set kind of some expectations. Any questions around this kind of second step? All right, I'm going to close that, stop sharing my screen, and find the next form. Okay. All right, so this is really what we're going to enter into now is kind of, if for lack of better terms, this is the curriculum that we use kind of with the families. So the first meeting or shortly thereafter, what you see here on the screen is our family development scale. And the 12 areas, I'm not going to go into detail here because the next form that we're going to look at is the detail. But this is what the family fills out. So when our philosophy in terms of coaching is that families, for the most part, know best what they want to work on, but we also, we know that they're going to be more engaged in the process if you're working on things that they feel are needs. I can tell you sometimes what they think are their needs and what the coaching agency has determined the needs might be different. So you might have to steer a family, but they complete this and they rate themselves basically in all of these: transportation, family relations, parenting, alcohol, drug abuse, all of the different areas that we're going to talk about. They rate themselves where they see they need the most assistance or they feel our strengths. When we go through the document, this is available in English and Spanish. And as I mentioned, this is something that the family actually completes. Any questions? Pretty self-explanatory. They rate themselves, and then this is used kind of as a guide to start those conversations as we work through kind of the assessment. I'm hoping if somebody could, I'm on a screen, if somebody could let me know if something comes in the chat, that would be great. I don't know if I can't readily see that.
I'll try to help with that, Julie.
Thank you so much. I appreciate that.
I did
All
have just
right.
a quick question about that
Yes.
scale. And I know you said the family completes it. Do you guys suggest the coach do that with them, or just kind of give it to them and let them work on it? What do you see works the best?
I think it's a combination. I think because I think there's some explaining that goes with that, partly because if you're just giving that to the family, they may not know family relations, they may not know what that is. So I think there is some coaching that goes around what this looks like. I think how people probably are doing it is that they're doing it together, but the family is putting their answers as they're explaining transportation, kind of some of the things, around what that looks like. And I don't know, Jamie and Carla both do this if that's the approach that they take.
Yeah, we've encouraged that this be part of a conversation with the family, working together and kind of sorting it out as they're starting. So,
Perfect, fantastic. Any other questions on that? I'm stopping sharing and I'm going to go. So the next form. Sorry, I'm going to stop sharing again. If somebody has a clue how to do that differently, that would be greatly appreciated. My age might be showing in my ability. So the crust of the work, the next document that we, and this isn't something H3C created. This is something that, I don't know if you are familiar with Karen Rathke at the Heartland United Way. When she worked for the Community Action Agency, this is a tool that she developed and it works well. It's a fluid document. It's a document that the coaches are coming back to weekly. It's not, although it's in a certain order, they may not do this document in that order, because going back to the same thing, this very much goes back to the needs of the family. So, we're going to go through it in kind of in page order, but knowing that that may not be, and the coaching agency may not necessarily spend a lot of time on some of these. So when we look at this, the first part of the form, just kind of demographics. You've got adult name, adult 1 and 2 in the household, name and children in the household, date the assessment began. So this is fillable. Either the coaching agency can print it out and write it, or they can fill it out on a computer if they want to do that. And this form is something that they do not turn into Hall County Community Collaborative. This is something that they keep on site as basically part of their family assessment. Name of person completing the assessment. So this is the coach that has been assigned to complete the assessment, and the agency completing the assessment. So that goes back to the referring agency. And there is an opportunity kind of for any general family notes. If there's things that they want to offer. I'm not sure how often the family notes on this particular area are used. And as we go through that, you might see why that is momentarily. So this is as they start working through, when we look at this, aligns directly with that family assessment that it's in the same order. And this form, this assessment may take several weeks to complete. This isn't something you may come across a pressing need that needs to be dealt with, but this then is basically the detail from that family sheet that you're going through. So when we look at transportation, you're basically going through all of the questions that are on the screen. What are some of your family's needs for transportation? Do they have a driver's license? Do they have access to reliable transportation? If so, is it insured? What does your transportation limit you from doing? Are you able to pay for transportation expenses every month? And when you look at question 6, every one of the pages have this same exact question. So the agency may work through this particular question and they may find that the family doesn't have transportation. This is a big one for families that we see transportation barriers might be an issue. So when they look at this, when they go down, would you like additional assistance? That could be a referral back to central navigation for a gas card if need be. It might be if they don't have a driver's license and they would obtain one. This is basically then the work that the coach is going to do with that family to help them move that transportation from, when you look down at the bottom of the screen, we're actually rating them to be at risk to thriving. So when you look at the transportation, and I don't know how well you can see what's up on the screen, but basically they've got the first, second, third, and fourth. So they're looking at this at the first interval that they're doing that. They're looking if they're at risk. So at risk for transportation, they have no access to transportation. Resources are not within walking distance. They have no driver's license, no vehicle insurance. That makes them at risk. If they're in the grayed out, kind of the dark gray, the 1 to 2 interval, you know, we consider that it's a current crisis or they have significant or severe barriers in that transportation area. So as they work through this, this was really this curriculum, for lack of better terms, it's not a curriculum, but this tool that we're using was really set up that you would reevaluate it every quarter. That we're not serving people that long. Realistically, you might be looking at this every month, only if they're in that at risk to the safe category. If you look at transportation and the people are clear over on the thriving side, they have access to reliable transportation, they have ability to maintain or replace the transportation that they have, you're not going to come back and basically reevaluate that unless, you know, through part of that coaching conversation, maybe something happens and they had access to reliable transportation, but now all of a sudden their car quit and now they've gone from being no barrier to thriving, kind of that 5 or 6, to now all of a sudden they're that 1 or 2 because now they have no access to the transportation. So when I mentioned that this is a fluid document, it absolutely is a fluid document. And I don't, you know, I think coaches are using this as a guide. I'm not sure they're probably having it in a binder necessarily and asking it question for question. I think a lot of this comes in conversation. They may, as we work through the document, you're going to see that a lot of the questions they might have answered off the application that they receive or through conversation. So they're not necessarily doing it question for question, but they might also be asking some of the things questions for questions. And then when you're looking at evaluating this, the safe zone is they have access to transportation from others. So they're able to get where they need to go, but they don't have their own reliable transportation. They budget for transportation expenses, or they may have, they own a reliable and insured vehicle, and you know they have a valid driver's license. So you can see how they move from the significant risk to the safe to the thriving. Not every, you know, when I look at how this connects to central navigation, we don't buy cars. You know, within the criteria that we have established, we can assist with some gas cards if need be. We can assist with, locally it's Crane Transportation Public Assistance, but our assistance is temporary. So when you're looking at transportation, you're looking at long-term solutions. So the coaches are, our agencies are fantastic. They're smart in the resources. So they're helping them work through what that looks like to get them from that at risk to the thriving. Any questions on the transportation part of that? And Jamie and Carla, as I work through this, you're probably more of an expert than I am because you work and live this every day. If there's stuff you want to add, please come off of of mute, and please feel free to add information.
I will hop in real fast if you don't mind.
Perfect. Yep.
One of the things that when I did some training with our staff here, that initial assessment that the family goes through, that we go through with the family, that's kind of what guides where we start with these assessments. So if a family's telling me that transportation is a need and that it's a struggle for them, then we're going to start in transportation. If telling me that, you know, food or shelter is a struggle, that's where we're going to start. And then eventually we can work through all of these assessments. So we kind of let the family's needs and what they see their needs as be the guide to start that conversation.
Yeah, thank you, Jamie. And I think that is why that assessment is so important, because I'm sure Jamie would also, if families are engaged and you're meeting what their needs are, or what they feel their needs are, they're probably going to be a little more engaged in the process. Thank you for that, Jamie. So when we look at family relations, really the purpose behind this is we're trying to figure out if families have a support system. So who do you rely on for help and support? And if you're part of Central Navigation, part of the initial Central Navigation application asks if families have support system, it asks how many people. But this is kind of digging deeper into who do you rely on for help and support. You know, the coaches might be, in some cases, their help and support right now, but that's not a long-term solution. How often do you see or talk to that person? Who do you consider to be a member of your family? And what community activities are you involved in? How are conflicts resolved in your household? Have you or a family member witnessed or experienced any abuse? These are some tough questions, and depending on where the family lies, and the answer, you know, if you're doing this after you or before you have a real relationship, these might be tough questions for people to answer. And some of these answers may be one thing or something that you talk about after 2 to 3 weeks in, when you've developed that relationship a little bit. Would you like more assistance with family relations? So when you look at the at-risk, safe, and thriving, physical violence, sexual, emotional, verbal abuse, if they're isolated, if the family makeup changes, those are some of the types of things that we're looking at that are considered high risk. You know, kind of that safe phone, if they're physically safe, emotionally secure, they have a consistent identity of family makeup, they have a positive extended family. That when they're thriving, they have a nurturing family environment. They have, you know, lots of support. They're active in the community, strong supportive network of family and friends. This is probably one of the, when you talk about at-risk violence, that type of stuff, it's a hard conversation to have. But when you look at long-term success for families, if they have that support system, that is really a core element that's needed for long-term success. So if a future crisis arises, they have people that they can go to and feel safe and secure in that relationship. Any questions or comments on the family relations?
I have a question. So say there's no violence, there's no abuse or anything like that occurring, but maybe they don't have that positive extended family. Maybe they're pretty isolated in terms. What would you put that as, like, as terms of like a 2 or a 3? Because that'd be kind of in the middle.
So I would say they're in the safe, because you said they do or don't have family.
So say like they're safe physically, there's no abuse or anything like that. They just don't have that extended connection with family or something like that.
I would put that as a 3 to a 4, because they're not thriving. They don't have that support, and family to them might be friends. But that might be something if they don't have, if they don't have a mom or a dad or something that's there, maybe it's a network of friends, but that might be something you want to work on so that they have that long-term support. And it might be referring them as we talk about education down the road, it might be connecting them with the group at the education. So it might be referring or helping them brainstorm through who could be considered their extended family. Is there a close friend? So I would put them in kind of that 3 to 4, because I don't consider them, you know, nurturing that type of stuff. There's area for growth, but yet you're right, they're not high risk. Good question, thank you. Other questions? Perfect. So when we look at parenting, have your children always lived in the household? What are the most important rules in your household? How are rules enforced? Describe your children's acceptable, unacceptable behavior. How do you respond to that? When you and your children have time together, what kinds of things do you do? Daily routines, celebrations, leisure activities, and then again, like more information or additional assistance. So when we look at being at risk, outside placement, threatened, children have run away from home, unrealistic or non-existent rules, constant conflict, children are withdrawn, they're violent, they're aggressive, parents are unable to relate to their children. So kind of in that safe zone, you have children living with parents or permanent guardians and no issues for removal. Realistic rules, manageable conflict. Children are usually happy, outgoing, little violence or aggression. They're able to relate to the parents. And then when you look at somebody that's thriving, children live with the parents or permanent guardians, mutually agreed upon rules and expectations, conflicts easily negotiated. Children are happy, socially well-adjusted, and children enjoy the parents. So obviously, you know, at risk, there's lots of things in there, but this is like Hall County Community Collaborative offers Circle of Security parenting for free. So that might be an option for referring. It might be connecting them with a parent support group that I know Families Care offers, but it might be finding resources for them. It might be, when you look at going back up here, rules being enforced, it might be helping them set a chart for their kids. So there's lots of, it might be connecting them with, if it's a school-age child, connecting them with resources from the school. So we don't expect the coaches to be experts in everything, all of these criteria that we're doing, but we want them to be able to know the resources that are out there. So then, you know, I should probably preface, so central navigation, with the funding, the primary funding that we have, we are unable to serve kids that are, they have an open case with Child Protective Services. So they would not come through central navigation. We would never have a family that is using central navigation services that is already, like, is out of the home placement. Any questions on kind of the parenting assistance? And I should preface, H3C, there's also Boys Town offers fantastic parenting classes through their agency. And I think between Boys Town and others might offer parenting classes too, but between Boys Town and H3C, there is usually a class going, the Circle of Security, a class going on starting every month. Perfect. Any other comments, questions? Perfect. So we're going to jump into alcohol and drug use. So this is a sensitive subject, obviously, and one that might either spark conversation or cause families to shut down based on some of the questions. So this is one, and as I mentioned, this is in the same order as that family assessment. This might be one that you talk about, if it's not a family issue, that you talk about later in the conversation. Kind of like that, the physical violence, that type of stuff. Does anyone in your family have a problem with the use of medications, alcohol, or other drugs? Does this affect your family, work, school, or other obligations? Have you had legal problems related to drug use? Has you or anyone in your household gone for treatment? Is there underage drinking in your household? What have you discussed about drug, alcohol usage with your children? Do your social activities involve drug or alcohol use? If so, how often? And again, going back to that, would you like additional information? So when we look at, there's several different kind of factors. There's no discussion of usage in the home. Their obligations are missed due to use of drugs or alcohol. So if the family were to say, you know, my child's late to school because, you know, I drank the night before and I can't get out of bed, that would be an obligation. Or they miss work or some of those types of things. They current problem and no treatment has been sought. Underage drinking. Most social activities involve drugs or alcohol, and you can see why this section is an extremely sensitive subject for the people that we're working with. So that would be current crisis, severe barriers. If you look at sort of the safer zone, parents discuss use of drugs and alcohol with the children. And, you know, if they don't, that's a great topic, you know, that you could provide some information. Parents model appropriate behavior. If there are problems, they've sought treatment. Some social activities involve appropriate alcohol and drug use. Then when you look at thriving, kind of no area of concern, they're able to fulfill all obligations. They might be former abuses, completed effective recovery treatment. No underage drinking, no social activity of youth involved in alcohol or drugs. Very few social activities of adults involve drugs and alcohol. Parents teach the children skills for healthy, abuse-free activities. Any questions on, and as I mentioned, this is very sensitive subjects, so this is probably one of those that you want to do later on in the assessment. Questions, comments? Perfect. So we're going to move on to children's education. So are your children attending school? Have your children missed school? How are they doing in school? If there's discipline problems, grades, relationships with teachers. Is your child involved in non-academic activities? Do they play soccer at the Y? Are they in Girl Scouts? Describe your involvement at your child's school. Were you able to obtain basic school supplies? And then again, would you like more information on what that's doing? You know, you might want to also talk about if your child is tardy to school. So when we look at basically risk, high absenteeism, or it could be tardiness, failing one or more subjects, the child is not involved in any non-academic activities, no parental contact with school, cannot provide for school needs, numerous discipline problems reported by the school. So that's considered high risk at the current crisis. In the safe zone, absenteeism is not really a problem or a concern. They have passing marks in all subjects. Parents attend conferences and have some contact with the school. They can supply basic school needs, and there's few discipline problems reported by the school. And when we look at somebody being thriving, little or no absenteeism or tardiness, high marks in most subjects, and high marks is relative to the child that, you know, in the family. High marks doesn't necessarily mean A's. It's the skill level of the child. Child is involved in non-academic activities. It could be something at the library, parental involvement and attendance at school activities. And again, they can supply the basic school needs and items for non-academic activities, and there's no discipline concerns. Any questions? This is a little easier to talk about. And this is a place, depending on those needs, it might be involving the school, might be conversations with the school, that type of stuff. Questions, comments? Adult education. So we're looking at the highest grade you or your spouse partner has completed. If they have any plans for continuing education, any goals, if they want to go back to school. Are you aware of resources to further your education or job skills training? Would you like additional information? So when we talk about employment, we dig a little bit deeper into this, but if a parent has a goal that they want to go back to school and get an associate's degree, a bachelor's degree, whatever that looks like, then one of their goals might be that you're helping them get to where they need to go. So when we look at a family in crisis or having severe barriers, they lack a GED or a high school diploma. They sees formal education as unimportant or inaccessible. They lack long-term goals for education or career or employment. So kind of in that safe zone, we're looking at that they have their GED or high school diploma and has begun job skills or vocational training. They've established goals for long-term education or employment. They have financial resources available to further their education. And when we look at somebody that's thriving, they have a certificate of completion or a degree. They have employment skills obtained, and they're pursuing long-term goals for education or employment earnings. Any questions on that? Perfect. And I don't know, I see the chat going off. Is that something I need to address? I just see it clicking orange down at the bottom of my screen.
That's a great question, Julie. I'm just adding more context in relationship to Buffalo County as you're talking. So yeah,
Fantastic.
nothing you need to worry about yet.
Okay, perfect. Thank you, Denise. I appreciate the clarification. So when we look at the income and budget, and as I mentioned kind of at the top of the call, this is where a lot of, at least the coaching starts with. It may not end there. The coaching agency may determine that there's a lot of other barriers or needs, but this is where a lot of our referrals come in. So what is your monthly income? And some of this can come off the application that we have with our application for H3C. They actually fill out a budget form, an income and expenses. And does your income meet your basic needs? This is some of the information that coaches are going to have when they come in. As I mentioned, if somebody's income is $2,000 and their expenses are $4,000, then there might be a lot of work in the income budget categories. What is your outstanding debts? Do you utilize a monthly budget? How much money, if any, do you save per month? And then again, would you like information or additional assistance with income in the budget? So when we look at kind of the current crisis, that type of things, they have little or no income. Their basic needs exceed their resources, kind of what we talked about, or inappropriate or excessive spending. And to give you an idea, some of the things that we see that might cause coaching, maybe somebody can't meet their needs and they're coming to us with rent assistance, but yet they're eating out at $300 or $400 a month. So that's an area that the coach could look and they're looking and saying, okay, where can we cut expenses? But to make sure that their basic needs are coming first. So kind of in that safe zone, they have regular adequate income. Their income meets basic needs. They use a basic budget, but they're kind of teetering that they're not fully thriving where they've managed their debt, their timely bills, their income allows choices and flexibility. They're saving 10% of their income. We see a lot of people that are, and actually COVID we probably seen a lot of people that were in kind of that safe zone where they had income coming in, but they were living paycheck to paycheck. And a lot of the needs that we have seen is that COVID hit and they were laid off or they, had to quarantine and their job didn't pay them to quarantine, and they just went from that safe, they're paying their bills, they're getting what they need to get done, but they're living paycheck to paycheck, and they went from safe to that at risk, just from a 2-week, I don't want to say hiatus from their job, 2-week quarantine from their job has taken them, and then now it become a current crisis where they no longer could pay their bills. Is there any questions or concerns on the income budget? When we look at employment, so we're asking if they have a job. Does your spouse or partner have a job? How many hours a week do you work? How long have you worked there? And are you satisfied with your job? That's a key question. A lot of times people don't stay with their job if they don't like what they do. Does your job include benefits? Health insurance, retirement, paid time off? Are there opportunities for you to advance in your current position? Have you had a recent promotion? Do you feel the company that you work for is secure in terms of not closing tomorrow? And this has taken on a whole new light with COVID. And if somebody's working in the fast food industry and they went from, well, yeah, my job's secure, I work at McDonald's just because that's the one. And all of a sudden the dining room at McDonald's closed and they're now only doing drive-through. And now they went from needing, 10 people to only needing 5. So your company might be secure, but maybe your job is not as secure as it used to be. What skills and or experience do you have to achieve your employment goals? What kind of work interests you, or what type of work are you looking for? And, this could be if they're unemployed, obviously the kind of work that interests you, what type of work are you looking for? But it could be if they're not satisfied with their job. Maybe they're working at McDonald's and they want to work in a nursing home, working with families, or working with seniors. What types of things hinder you from finding employment? And, on this note for central navigation, one of the things that we can provide, so if somebody comes to you and they're saying, hindering employment, I need work boots for my job, and I can't find a job unless I have this certain equipment, that's something central navigation then could help pay for to get them, or it might be tools that they need to get started. And would you like additional information? So when we look at somebody being at risk, they're not seeking employment. And keeping in mind, from the central navigation perspective, we are short-term, we're not intended to be long-term assistance. So the coaching, we're hoping that coaching will be able to kind of help them move from that emergency assistance to being self-sufficient. So if they're not seeking employment, they lack job seeking skills, they maybe don't have a resume, they don't know how to dress for an interview, they don't know how to fill out an application, they have no employment or short-term employment, no benefits, no growth opportunities. As you can imagine, the employment, depending on where they land on the scale, can impact so much of the other areas that we're talking about. If they don't, they may be underemployed. Some of those types of things. So when we look at SAFE, they have long-term employment with no opportunity for advancement. They're employed by a secure company offering some benefits. They've attained marketable skills. And ultimately, in terms of being thriving, we love steady advancement and career of choice. They are employed by a thriving business offering a comprehensive benefit package, and they pursue ongoing training. Any questions? And this is the one section I think that is 2 pages, just because there's so much that goes into the employment. Questions? Perfect. So we look at healthcare. Describe when you and your family members go to the doctor, dentist, eye exams, counselor, those types of things. Are you currently seeing a therapist or a counselor? Do you have transportation to seek healthcare services? Are you currently taking any medication regularly? Do you have resources to pay for medical expenses or medical services? And when you look at, we see people that are underinsured, that maybe don't have access. I think, and there's not a whole lot of assistance if somebody doesn't have health care. There's some assistance through hospitals and clinics that operate on a sliding fee scale, but we look at risk. They lack financial resources for medical care. They have no transportation. They're unable to recognize healthcare needs or needs for services. So if you have a family that doesn't get any wellness checks for their kids, that maybe they're not unable to recognize it, but they're just not, they don't see that that's a need for services. So when we look at kind of that safe zone, we're looking about that they have that reliable transportation. They have resources to pay a portion of the healthcare expenses. They recognize the need for healthcare and obtains help, and then they might have Medicaid. Budgets, thriving, they budget for healthcare expenses. They have comprehensive private healthcare coverage. They practice preventive healthcare measures. Any questions? Most of this, not self-explanatory, but kind of gives you some idea where they're at. So when we look at nutrition, and this is interesting as I talk through that. So do you have enough food to last the month? We have seen an increase, which I'm sure everybody has, in the amount of people that are for the first time seeking food services and during the COVID crisis. What are some of the most common meals your family eats? What kinds of foods do your children snack on? Really getting around that nutrition. How well do you think your meals and snacks meet your basic nutrition needs? So when we look at successful or thriving, at risk, obviously, if there's not enough food and they're hungry, unable to prepare food. So maybe they don't know how to prepare food. They do not apply nutrition knowledge. Safe, they have an adequate food supply, adequate food preparation skills, and they apply basic nutrition knowledge. And when we think of thriving, we think that the family has a well-balanced diet. They're looking at, the different, food groups. They have a balance of meats and fruits and grains and vegetables, and that they're able to prepare that food at home versus doing a lot of fast food, because we know that that's not healthy. Questions? And I believe housing is the, oh, no, we have two more. Sorry, I thought housing was the last one. So when we look at housing, you're looking at their rent, utilities, insurance, maintenance. Not everybody has insurance, but even in a rental, they may have rental insurance. And you're looking at the total and based on their income and really looking at what the percentage of the amount of money, the income that they have is spent on rent. So we consider at risk if they're at that 33.3% of their income. They're in sort of the safe if it's 30% with all of those different. And then if they can keep those expenses to less than 20%, we consider them thriving. We're also, in addition to just looking at the numbers, dollars and cents, we're also looking at if they're living in reliable housing of your choice. Not all housing is reliable. Do they have a current eviction notice or disconnection notice? And hopefully from our perspective, if something has changed over time, when we look at a referral for central navigation, if they have a current eviction disconnection notice, we're going to help them deal with that initially, and then it might be an ongoing conversation, but hopefully at least initially people aren't going to come to you with a current eviction or disconnection notice, because hopefully we've assisted them with some financial assistance, but it also could come up later. But if they don't, the number 3, have you had an eviction disconnection notice in the past 6 months or a year, to try to prevent that from happening again? Is sleeping space available for all family members separate from a living area? You know, we prefer people not sleeping on the couch if at all possible. Do you feel threatened with injury in your neighborhood? Is your house warm in the winter and cool in the summer? Has your water been tested? Is it safe to drink? And would you like additional assistance with housing? So when we look at being at risk, in addition to the categories that we already talked about above, based strictly on the income, if they're homeless or they don't have shelter, if they're living in a private or public shelter, if they're near homeless, either if they're in the process of being evicted, or even if they don't have an evicted notice or are in that realm, if you look at their income and there's no way, we had a family that their rent was $1,500 a month and she was not currently working. Well, there's a pretty good indicator that when you look at her housing is going to be at risk. If not immediately, in the very near future, it's going to be at risk. We talked about the spending. They rent or own, it's unsafe or it's overcrowded housing. So when we look at safe but temporary, 6 months or less, they have the payment, they have safe housing, but it's more than 30% of their income. They're living in public housing or using a voucher program. So we know at least part of that is taken care of. And when we look at really thriving, we're looking at all of those things. They spend less than 20% of their income for those shelter expenses. They rent or own, it's safe, it's adequate, it's affordable. And it, you know, when we talk about adequate, that there's enough space for the family and it's their choice. If they, you know, want to live in an apartment or a house, that they're able to choose what that looks like. Any questions on housing? Very good. The last one then we look at is legal. And there's been a lot of conversation. I think COVID has been not a bright spot, but there's been a lot more information coming out around legal aid. But we're really looking at if, sorry, I probably could have taken some of that off my screen. I'm just going to exit out of my, sorry. Apparently I was doing a little bit of work. Okay. So do you have any current or pending legal issues? You know, we're not here to necessarily solve their legal problems, but we might be able to refer them to somebody that can. Do you have any current court dates, fines, or restitutions pending? Do you have an attorney? Are you paying or receiving child support? If so, are you owed or do you owe back pay? Do you have a pending disability claim? And again, looking at if they need additional information. So we're looking at risk if they have legal issues, upcoming court dates, delinquent in child support, they need legal counseling. So they're considered current in crisis or severe. Then we're looking at safe that they might have some legal issues, but they've made arrangements for those. They're in good standing with parole, if that's the case. Legal advice has been retained and payments made for child support or fines. And when we look at thriving, child support is current. They have no legal issues. They don't have disability claims and they have no outstanding warrants. Any questions that on either the topics that's basically the assessment that we use as coaches work through families. Is there questions, concerns, comments? And knowing that we partner with coaches and that are very good at doing the coaching job. They're not, just because they're coaching for us, they're not new to coaching. So they might be using this, but they might have some other tools or resources that they kind of bring into that as well. They may ask the questions a little bit different to get to kind of the same answer. So there are questions, comments, concerns with the actual assessment that we use. It's pretty comprehensive. We hope we've covered most of the issues around families. Perfect. So, okay, I stopped sharing. So let me find. So basically, after we, I'm going to re-share my screen here. So once we kind of go through as I mentioned, the coaching agencies are working through this, weekly over the course of months with families. They're doing referrals. They're, doing what's best for the family based on what that looks like. So what we ask from our coaching agencies is a summary. So as I mentioned, everything that we've talked about previously, the family assessment, with the exception of the referral form that comes from H3C, the contract the agreement that they have with families, the assessment, that all stays at the coaching agency. But we needed to have something that basically gives us a brief synopsis, provides us an update, something that would be able to substantiate payment to our funder. So this is what the coaching agencies complete per family each month, and it's the monthly invoice. So the billing period, January 2021, they would give the family number or the family ID. And that is, we use the central navigation. It's like the first and last name, and then the birth month and the birth date. The coaching agency, the coach's name, the phone number, and the email. And we ask them to list the dates and the amount of time spent with family during this billing period. And as I mentioned, it goes to the nearest 15 minutes. And we do ask that it's January 5th, 10 minutes. And most of them put if it was in person or virtually. And then this here is actually what we use for payment. So we take, if it totals 2 hours or whatever, then they put the total time spent for the family this billing period. And then that is what we use to pay that $50 per hour. We also asked for them to provide a brief summary of what took place during your coaching session with the family. So we do not expect a rerun of everything that they've done, but kind of the highlights. So if in an example, I met with the family once a week, we were able to refer them to workforce development, for jobs, connections that they made. They also put if the family was struggling, just kind of a brief synopsis for us to be able to get kind of a snapshot picture of the family, the progress that they've made, any additional concerns or obstacles they have in moving forward with working with them. Using an example, we have an agency that said, the family, the individual is refusing to do the hour visit. They only want to do a half an hour, just kind of some of the barriers. This is also new to, this is also where they're documenting if the family has met a SMART goal. So if using the goal of employment, if they set a goal with the family that the ultimate goal was that they get a job. And I apologize for those that you were on the call Friday, you're hearing a little redundancy, but if their action plan was that they are getting a resume, that they are calling 5 places to get job applications, that they're going to practice interview skills, whatever action steps they have for that goal, that is part of not only do they need to keep the family needs to keep their visits to get an incentive, but they also need to achieve not the entire goal necessarily, but action steps along the way. And we're relying on the coaching agencies to basically help them set those goals and make sure they're attainable, so that they would say, Julie updated her resume and, that was a SMART goal that they achieved. So that is what then we're looking at to qualify for that incentive. That's the documentation that will go along with that. So we're also charting, so that's kind of page 1 of that document. Then we're also charting, kind of going back to that family development scale that we have. The coach is filling out the client's name, the date, and the initial visit. And then these are basically the first month, the second month, and the third month. So this is an ongoing. So the initial visit, when they do this the first month, the coach fills it out, and they're putting that where the family situation is. So again, going back to that same assessment that we have, that 1 through 6, then we're charting that. And then, so that would be the initial visit. They're actually filling this, going down, filling it for each additional month. So we're able then to look at the progress that a family made. So in month 2 after the initial visit, and even on the initial visit, they may not have gotten through all of, so maybe they talked about transportation and transportation was a 2. Maybe they didn't get to alcohol, drug abuse, family relations. So maybe in the first month, it's not applicable because they didn't get to that position where they know really what the strength or the weakness or the number kind of scale, what that looks like. As they move forward, when they get through all of the coaching sessions, there should be a number at some point with each of these areas. So if transportation started right away in month 1 and it was a 1 or a 2, what we're hoping to see is during the course of the coaching that transportation moves from that 1 or 2. Ultimately, we'd love for it to be in that 5 or 6, but we know realistically, not every family is always going to be in that thriving. So we're hoping at least they move from the 1s and 2s to that 3 and 4 where they're at least safe. But as they move forward, so if family relations or transportation, using that as an example, if it was a 6 or a 5 to start with, then in future months that would be an NA because the coach hasn't worked on it. They don't need to work on it, but there might also be some things, again, any of these could be any of the numbers, or it could be an NA. And it could be that originally, if we, when we talked about that transportation, so the initial visit transportation was a 5. Their car broke down. So now in month 2, transportation now became a 2. And so they basically complete this same document each month. They're just updating and submitting it. So as they move forward in the coaching, I'm able to see month 1, month 2, month 3, and then the outcomes report, if they have the budget. Oh, looks, we got some numbers in our template, that they're looking through what that looks like in month 1, month 2, and month 3. And we're also looking at then the full-time, part-time, the health insurance, education, kind of some of those things that we talked about, yes or no, and as they're changing over time. So kind of a quick synopsis, when you look at just using employment, if caregiver 1 is employed, yes or no, we're hoping that they stay yes full-time, but maybe in month 2 that has changed and now they're not employed or they're employed part-time. And again, this is the way for us to be able to chart kind of the progress over the months. And we basically, again, go through not every category, but kind of some of the larger categories, or we've summarized some of that together. And so this is what then, as I mentioned, this is what comes in. This is per family. This is what is submitted by the coach to H3C and Central Navigation. I pay the bill. Jessica is actually looking more at the progress that the family is making. And unfortunately, we're early enough in this that we're not really doing anything with the information. We hope at some point to be able to actually look at the growth that is made. We just haven't figured out what that system looks like. any questions? And this is a PDF. And if Denise, you guys decide to use kind of the same thing, I can either put it in a Word format or whatever, and you guys can edit it as you need to. Any questions on expectations or kind of how we use the monthly invoice or the responsibility from the coach's perspective? Perfect. So then the last thing that we look at, so we wanted to have a way that we would be able to kind of have a case closure. Some way that we could either determine if that the case was closed on the family, but if it was successful or unsuccessful. So this is what we ask the coaches to complete. So again, the billing period, the month, the family name, kind of that's all generic, the coaching agency coach's name, phone number, email, and the date, the contact spent with the family. So this final form, so this is also used primarily, or a lot of times we wanted a way. So if I refer somebody to Jamie and Jamie tries January 5th, the 13th, the 20th, and the 20th to get with the family, and there's no contact, then they are basically closing this out and putting that down, and they're saying, okay, I documented, because we pay, I think I mentioned, as part of the contract, we do pay basically up to an hour, because we do know that coaches spend time and they get nowhere with the family. So then we are looking at the total spent with the family for the billing period, might be an hour or a half an hour, whatever, we give them an hour. And then they're letting us know if this case is closed successfully or unsuccessfully. We have some unsuccessful, we have had lots of successfuls. That, for instance, the primary reason somebody was referred to a coach was that they needed to get a job. The family member got the job, they've finished their contact, and they've done the case closure. And then this is just kind of our way of knowing that we're basically closing the case on that. And then we also then take, like if this was at Families Care, then we say, okay, Families Care is now down to 2 families versus 3 families. So we're looking at that. And then again, the brief summary for coaching sessions. And again, primarily for the ones that are unsuccessful, meaning that they never even completed any of the assessment, that type of information. And we do keep that on file. Not that families can't be referred to coaching twice. But we do look, if we referred a family to any of our coaching agencies and the coaches made the attempts that we request that they do, we do prefer that people make 3 attempts with no response. That's kind of what I think mutually agreed upon was a good benchmark to say that, okay, people aren't interested. Then if I was referred and I wasn't successful because I never connected with the coach, and when they come back to us, and usually what happens is they come back to us and request additional assistance in terms of rent or utilities, that does factor into, because we're not meant to be long-term, we're meant to be emergency assistance. And not that we don't ever refer them back to a coach, but we do look, if they were unsuccessful, to make sure that the family understands more so, kind of what those expectations are. And so then, as I mentioned, this is what closes out the case. And then the people are coaching agencies are paid monthly via direct deposit. Denise, do you want me to go into kind of our incentives?
Yes, I do. I think we've had a couple conversations with Kelly, at Compass, and I think they're already starting to see the challenges of incentivizing this work. So I think, Kelly, would you agree? Would you like to hear some more about how they're doing that?
Yeah, definitely. Kind of what they've seen, what you guys have seen working or not working, and just in helping with engagement with families for sure.
Okay, perfect. I'm gonna unshare, find my document. And I will be real honest. I think this is something that what we thought originally, oh, let me just find my, what we thought originally would work with families. We found that we thought throwing money at them was the answer. So when CARES funding was first into place, we basically did, you can get, there was an extensive amount of money. You could get a full month's rent just simply for showing up for 4 visits. What we have found is that, maybe it helped the problem, but they weren't any more engaged throwing money at them. So we have, what we have come up with, so we kind of and actually what we heard from coaches was that the only thing people were doing was basically coming to the meeting, not really participating, not being actively engaged. They strictly were there just for the money. And so we just redid this. That ended the end of January. And so here's what we have put in place. And just being real honest, we just put this in place. So we're hoping it is a little bit different. We have families are being referred to. So this is the program that again, it's voluntary. So what we have come up with, the incentives will be given for the following benchmarks by engaging with the family coach. And we had a lot of conversation about what incentives would look like. And part of this is the parameters around our central navigation program that we have. What we are now looking at is the active participation in the weekly 1-hour calls with family coaches. And they're completing that SMART goal that has been set. So example, finding a job, finishing a parenting class, or achieving the specific steps outlined in the goal. And we are really looking to the coaches. You guys would know the families best. You would know what incentivizes them. But we had some parameters around what that looks like. And we also, when we decided to add the goal as part of that, we wanted it more, we wanted something for them to have skin in the game, for lack of better terms. We wanted them to have to be able to achieve something, partly because I believe it will help their long-term situation, but they're probably going to feel better and we can celebrate successes. Those small goals, those small steps along the way, we also didn't want it to make it so that finding a job, if that's the goal, that's the ultimate goal for this family. But finding a job, and I'm thinking about a specific example that we had with one of our coaching agencies. The family had, the dad was trying his hardest to get a job. He has some things in his background that made it very hard for him. So his ultimate goal was finding a job. We wanted to celebrate that, but we also wanted him to not get discouraged along the way, because you guys know, working with families, sometimes things for us, when you're in the middle of trying to work through some of this, it can be pretty overwhelming. It can be challenging, and sometimes what we consider small steps for them is a huge step for them to be able to do that. So we wanted to be able to, I hate to use the word reward, but to incentivize some of those steps along the way. So we have put it, a lot of thought went into the things that we have. So partly the rent, utilities, and the transportation, those are our three biggest needs for families that come into our program. And we also know that rent, utilities, and transportation, all of the different funding that we have for central navigation, every one of our funding sources, rent, utilities, and transportation, is allowable. And we had a lot of conversation if somebody wanted a Walmart gift card, you know, to go and buy gifts, that type of stuff. We ultimately decided not to include that as what we would pay for. Partly it's based on funding, but we've then figured if we're going to incentivize rent, utilities, and transportation, families could then, that would free up money if they wanted to use money for those birthday gifts, that type of stuff. So we have $250 to $500 per month, and they have a maximum of $1,500 for the duration of coaching services. And as I mentioned, the rent, utilities, and the transportation. And in our previous incentive, we said, we'll pay your next month's rent. Well, it wasn't really equitable. And for some families, that meant their rent was $1,500. So they got a larger incentive basically for the same amount of work. So it wasn't really equitable. And we also felt that we wanted families to have more of that active engagement. The reason it's 250 to 500, there's a range. It does give the coaches and the central navigator flexibility in the type of goal. So for somebody, if they completed 5 job interviews, for example, that's a pretty great achievement. So $500 is a little bit more of an incentive than $250 if, and I'm not trying to put value on necessarily the goals that they have, but we wanted some flexibility in that for the coaches and the central navigator to be able to look at that and go, wow, that was a pretty big achievement, you know, to be able to do that. We do not give any money directly to the families. So the rent, utilities, and transportation, with the exception of the everything except the gas gift card is paid directly to the obviously, like in Grand Island, it would be the city of Grand Island or a public power district. If it's a smaller community, that is paid directly to either the landlord or the utility company or the insurance company for car insurance, a car repair, or car payment. We do, with transportation, we do require multiple bids on if we're doing a car repair to ensure that we're kind of getting the best deal. And our gas cards, we also work with Casey's, is who we do our gas cards, partly because they're available in most of the communities where we work at. A lot of the smaller communities have Casey's, and they also limit the gas cards to gas. So there's no alcohol or cigarettes that can be purchased. And that was important from my board's perspective, that be used appropriately. And so, as I mentioned, when we look at is there questions or discussion, I guess, on either the why, the amounts, that type of stuff? And I think from our perspective, I think this is something that we will continue to look at. We basically did our first incentives for about 6 months. We had people applying, well, maybe not quite 6 months, people applying for incentives and the feedback and that. So, and partly our funding source changed. So as part of the central navigation application, if the coach has determined that they're eligible for an incentive. I don't know, Denise, if you use just the traditional central navigation forms from Nebraska Children. But basically, it's the Support Services Fund app. We've just switched softwares, but it's basically, we ask them to fill out what the need is, who they're going to pay to, the amount they're requesting, that type of stuff. And then we do have to have the documentation. So if we're going to have rent, we do have to have the lease. We may already have that on file if we have paid rent. We do need a utility bill. And then like transportation, we would need verification either of like the repair costs, the car payment, the actual documentation, and then the insurance. And then that's added as to that invoice summary that I'd mentioned on that form. And then it's emailed directly to the central navigator. For us, all of our incentive, really all of our central navigation expenses are paid within 2 weeks. The Heartland United Way, who has that program for us, they pay every 2 weeks. So questions?
Julie, just to answer your question a minute ago, I'll try to answer that. We just developed the forms. We kind of looked at yours and adapted those. And you know, since we don't do central navigation exactly the same as other areas, the way that you guys do, we try to kind of stay behind the scenes. Looks just a little different. We're still trying to kind of work through that and trying to find our footing on that, but hopefully that answers your question.
And I think the beauty is, the beauty or the however you want to look at it is that it can be adapted to however each community or each central navigation or each collaborative wants to use that. Because everybody's system, I think, works a little bit different based on the needs of either resources that they have in their community or how they're structured. Any other, that was kind of what I had planned to present today. I don't know if there's questions or anything else, Denise, you wanted me to cover, or Wanda, either anybody from Buffalo County.
I had a question, Julie. I think we were doing a little bit of the chat in the chat box. Going back to those original, I don't know what to call them, but the forms where you were going through transportation and the 6 questions and then the ranking at the bottom. On that 7th question, how do you feed that information when they're asking for additional supports or resources? Since those copies stay with, let's say if Compass moves forward with this type of tracking, it would stay at the Compass location. But then how do we gather that information about what those additional supports or parenting classes or things that people are asking for to help elevate that in the community to really support that with funders or additional resources, or to kind of set that agenda with decision makers in the community?
So I think on the monthly invoice is where our coaches are documenting, like they referred for food. They referred to a lot of the parenting referrals come back to H3C, and then we're referring them out. So we're able to do that as well. So that's the only place we're really doing that. I think you guys could change that if you want to have them submit that. I think that that's your absolute choice to be able to do that.
And then tell us a little bit about your makeup within Hall County, about how, because you have like a monthly coaches meeting, and then is there also a statewide coaches meeting? Or tell us a little bit about the structure and the conversations behind the scenes.
So I wish there was a statewide coaches meeting. That's actually something I have requested, partly because I consider us new, and I think we could learn a lot. I think coaches could learn a lot from each other on a statewide or even just a regional level. I think when we look at, like Buffalo County Sandhills, just in this area, we have several collaboratives So, and ours is structured, you know, we talk about cases. We don't know confidentiality is broken, but we, you know, people give updates on cases. If there's things that they're struggling, we believe that people can learn from each other. We usually have, if there's any updates from H3C's perspective in terms of if there's billing updates, that type of stuff, it's pretty informal. And then we talk kind of about the number of cases. We've done a lot of brainstorming in the last few months over the structure of the program because we believe coaches, the agencies that do that, are living it, breathing it, eating it, maybe not eating it every day, and doing that. So we don't, H3C and our central navigator do not profess to be the smartest people in the room when it comes around that. So I think we've done a lot around learning and kind of restructuring, revisiting, kind of listening to what they needed and then structuring accordingly. And then like the last month, just last Friday, we did some training on your money, your goals. We're gonna look at, we just talked about the SMART goals last week. So our goal is then to have some either access to resources or some type of tidbit of learning information that would take place. So that's kind of how we envision being structured, or that we are structured, but kind of how we operate. And it's always the same time each month. And sometimes we hope at least one representative from all of our coaching agencies can be present.
Thank you, Julie. I know, I don't know if I was speaking for Kelly and Carla. I think as we started having conversations about coaching, we just jumped in with both feet and said, okay, we'll start paying you to talk with families and helping us to navigate this together. So we did just jump in with both feet and then just kind of try to figure out where we're going from here. So I wanted just to open it up for both Kelly and Carla just to talk a little bit, maybe what was the biggest aha you had, or where are you feeling after you've kind of heard from Julie and what Hall County's doing? Do you want to start, Kelly?
Yeah, I think that, well, it sounds like, Julie, that you're working hard to have kind of a more unified approach for measurement and all that kind of thing across all your different coaching partners. And I think that's a good idea. I think that's something that can streamline the process and help everybody be speaking the same language, as well as measuring progress from this, you know, our first contact with the families through the end or the case closure. I think that's a really valuable thing. You know, we all probably have kind of our own models for that, but bringing in some uniformity could be helpful. And then, yeah, I'm really excited to hear about kind of the incentives and what hasn't worked and what you guys are trying now. I think that's a great thing to be looking at. So.
Denise, this is Carla. We've been along with Julie and H3C the whole time as they've been developing this. So that is how we are working our coaching families that we're helping H3C with. We are new to working with you guys in it and haven't had any referrals yet, but we'll definitely handle it in the same manner if that's the way you guys choose to go. So.
And I would just like to hop in for a second and just say I have appreciated these forms, the way it's laid out so well, because it does cover all of the life domains. I think it gives us a good way to measure the progress. You know, it helps us see that the money that's being put into it is benefiting the family and it's helping them grow. And so it's a good way to measure those outcomes and to be able to show that the money is being spent wisely and is useful for helping families get through some of these challenges. So.
For those of you that are using that assessment, maybe, so Jamie, I don't know, you or others, correct me if I'm wrong, what I'm hearing you say is about once a month, you're going through that domain assessment or family's needs assessment. But it looks like a pretty in-depth assessment. And Julie, you were saying your model is really about four hours per month. So just kind of playing it out in my head, it looks like a about one of those sessions a month, you're probably spending doing that assessment. Those of you that have been doing this on the ground, what's been your experience with that? Are you doing it differently? Does it go much quicker than I'm envisioning it in my head?
I guess the way I coach it is to really focus on those areas of need. You know, if you're thinking a family has 3 or 4 areas that they really have some needs in, then we're going to focus on those areas and set some goals in those areas. And then we can go through those goals at the end of the month, and, you know, just before we do like our summary or the assessment at the end of the month, to see where we're at with those things. So I don't know that it has to take up a whole session. I think if, as we're working with families, we're going to hear, you know, oh, well, I lost my childcare, or I lost my job, and that might change it a little bit, and maybe require us to go back and look at some of those other pieces. But I know Trista's got a couple of families she's got a lot of engagement in. She might be able to speak to that too a little bit.
Yeah, so what I've kind of done is, so I do this whole packet kind of at the beginning. I try and spend some time getting to know the family, letting them get to know me and build that relationship. But initially it does take me about almost 2 hours, I'd say, to go through this whole thing at least once. And so I try and do that towards the beginning, so then we can kind of really work on these goals, build some goals. And then like the second and third month, I don't go through the entire packet. I kind of address the needs as they're met, address the goals that we've created. And if we're still like on one family, I'm really hitting active parenting hard with their parenting goal. If we're still continuing with that, I don't really focus so much on, oh, let's work on A, B, and C goals. Let's get this goal nailed out. This is what you're really wanting to work on. And that's been kind of my focus with a lot of my families. And then like if they do have a need pop up, and we have conversations in between working on like active parenting and things like that. So it's not just like, oh, we're just working on this and we're not connecting or anything like that. So I do try and have those conversations at the beginning. I always ask, hey, how are you doing? Anything new this week? And addressing it that way and kind of talking about that in that sort of manner.
Yeah, that's helpful. Thank you.
I do have a quick question, Julie. So I wanted to clarify, as far as like the billing paper, do you want us in that section of comments to write what they want as an incentive that month?
Yeah, that just changed as of with this new incentive. So yeah, if you can just put in there kind of the goal that they met or the action step. And then if they're seeking, you know, if they want rent or whatever, but you still, that support services form. And I think I'm looking to the 2 faces that I can see. I think Jessica emailed that out, right? The form last Friday. I'm not, maybe she didn't. But then that support services fund form that you filled out in the past for them, then that's what we have that would say like where the payment's going to go.
Okay,
Like
and
to
so,
like the landlord, or I can send that out just to make sure.
okay, and I just want to clarify, because before, I don't know if this is new or if I was just misunderstanding. And a couple of the families I got were like back in November and December, so keep in mind this might be all information I have. But I thought that it was just like a one time at the beginning. They work the first month and then they get one incentive and that's what they get, and they can choose to keep working or not. So is that new monthly kind of like the 250 to 500, the new updated version then?
Yes.
Okay.
Yep. Yep. Instead of getting that one time, hopefully what we're hoping is that it's going to incentivize them in a positive way, because we were seeing a lot of one and done, like they got their benchmark done and they got what they wanted and then they weren't doing anything. So we're hoping smaller amounts along the way instead of giving that 1,500 one time. So I don't know, and we'll see. As I mentioned, I think it's something that we're going to try this and for 6 months, and we'll evaluate, and we're going to look to you guys doing the coaching to tell us if you think that that's making a difference for families. It's tough, you know, we want to try to do something to keep them engaged, actively engaged.
And Carla, I would say for your team, if you're doing that with Hall County, I don't see any reasons why we couldn't do the same thing in Buffalo, because we would have those same funds that we could support those families. So I think consider, as you're working through those families, to use that same type of paperwork and keep in contact with Wanda and Martha if you're looking at an incentive for a family. And so we can earmark that and kind of think about how we want to process that and support your families. Now for Compass, I've already seen, your paperwork come through for invoicing, and you guys do beautiful work, absolutely beautiful work. I think the first invoice that came across my desk, I was just in awe, and shared it with Wanda and Martha, and they were so blessed to have so much wonderful information come in from the family, so we could feel like we're walking right along with you with the families that you're talking with. So I know you're really trying to process all this information and try to decide where do we go now. So I just want to say, we don't have to drink from the fire hose today. What Julie's been doing is, quite a few years of coordination and support and wonderful, wonderful work. And we just kind of jumped into the fire with both feet and just kind of trying to figure out where to go next. So I'm excited to hear what your team is thinking too, Kelly, for the long run. If there's pieces or parts of this that you want to get started on, and where maybe in the long term we want to see as a community as we move forward. But I just wanted to say that this is just kind of an idea of how we could get started, the different elements that we could work from, and really take those pieces and tailor that to Buffalo County, because Julie and her team do such amazing work.
Yeah, that's great, Denise. I was thinking that after hearing all this, I think a phone call is probably in order, and we can brainstorm on kind of what are your top priorities and how we can continue just kind of make things better. So yeah, this is great.
And I know incentives on the top of you guys' list. So I think I am very willing, and I do believe, and Julie could probably back me up or challenge this, but I do believe Nebraska Children and Families is open to us discovering different ways that incentive might work. So if your team has some ideas of how you would like to incentivize, let's try a few things. Let's see what might work and what doesn't work. And I think Nebraska Children and Family would be very open to hearing what's working or not working in our community. And so that's a conversation we can continue to have. But I would love to lean on your team who's working with those families to tell us, boy, if this family had XYZ at this moment in time, when they're completing this activity or at this this point in their journey, this would really help the family. We would be supportive of that.
In my 2 cents worth, I think that's the toughest thing that we continue to struggle with, what works, what doesn't. So Denise, if you guys come up with, that may be a conversation we continue to have too, because I think it's hard, the balance between what works for the family and that type of stuff. So.
Well, thank you for your time today, Julie. I appreciate it. I guess it doesn't sound like we have a lot more questions. I did want to follow back up with Kelly on a phone call and with some of our team members. And I don't know if you have some team members too that we want to include in a follow-up call just to kind of figure out where we want to go next. And then Carla, it sounds like maybe you and I can just stay on here for a couple minutes and have a conversation. Other than that, thank you, Julie, for investing your time. It did look like you had a grandchild that really needed your time and assistance. So thank you so much for giving of yourself and your time for us.
Oh, no, that's fine. I am living in Omaha these days after my son's surgery. So I'm the caregiver. So he did actually pretty good. So
Thanks,
I
Julie.
don't know if you've seen me kind of doing the, trying to be quiet, but no, he did very good. So wonderful. Thank you, guys. I appreciated meeting everybody. It's nice to learn a little bit more about Compass and the work that you guys do. So thank you guys very much. Take care.
Thank you.
I'm going to jump off the call.
Thanks, Julie.
Take care.
Thanks, Julie.
Thank you, Julie. Yes, Carla, I can stay on for a bit.
Oh, thanks, Denise. I just thought Jamie and I could visit with you for a few minutes to clarify a little bit about the 2 different contracts we have with you guys.
Yeah, no, I think that
Different
sounds good.
programs.
Okay.
And some of the team might stay on too, because they probably
Oh,
have some of
that's
the same
fine.
questions you have.
Sorry, I don't have my face showing today. It just doesn't feel like a day I want to show my face.
That's okay. We're very
So-
forgiving.
Denise, your last comment about us using that stuff lends me to think that you might think we already have coaching families at Families Care. Just you commented that we are already familiar with using that paperwork with
Oh, the
3C.
paperwork with Hall County. Are you doing coaching in Hall County?
We're doing both in Hall County, PC and coaching. And I thought that's what we were doing with you guys, but I just wanted to clarify because I sometimes like Amber and I were having some email back and forth too, because it almost feels like the two are being lumped together a little bit. So I just want to make sure we're all on the same page as far as seeing these as two separate programs, and that maybe if you guys have any questions about what the difference is between the two, or
I think we have clarity, but there might still be some questions. So what I believe we have in email form, and maybe we can kind of nail that down today, is the contract for coaching. And so my question to you is, what is that initial payment? Right now we negotiated with Compass for $100 for that initial intake for coaching. And so that is the amount I need to drop into the contract. And I'm not sure which amount you want me to drop in, if $100 will work. And so what we negotiated with Compass is that no matter whether that family agreed to move forward with coaching or not, that first payment would be $100. And then every hour after that is $50. Does that sound right? So that contract is ready. I just need to know what amount to drop into that initial.
no, that's perfectly agreeable to us. Whatever you're doing
Okay.
with Compass is just fine.
So I will drop in that amount and I'll send you the contract, and then we'll get the coaching contract signed. Now, I don't know that we have any kind of contract for PC set up.
Okay.
I
thought
don't
we did
know.
one, but let me look back through my records too. You didn't think we had one, Denise?
I don't remember drafting one for PC because that one I'm not real sure of all the different commitments, other than we've said, send us invoices and we'll pay them.
Yes, because I
And
know
so
we've
then-
gotten payment.
Yep. And so we've been paying those invoices, and then we're like, okay, since we just decided to jump in the middle of this with both feet, we have no idea who we're paying for. So then it was like, okay, how do we get some sort of documentation
Mhm.
on those 3 or 4 families in Buffalo County that we're paying for? So that's when Amber asked for the CRT forms, which, Amber, do we have all those?
You're missing one still, correct,
What?
Amber?
Okay.
PE, the initials PE? Yep, okay. That's,
And I would say
Get
any
to-
kind of information you can just give us. If we just have a name, I think would be great, just so that we have that on our end. So if we get audited, we can say that XYZ for this family.
so
And I
those
think we'll be
forms
fine
then
there.
would give you guys what you need, basically. Yeah, okay, and
The
then
PC
what I
side.
send with the monthly billing, those summaries, I mean, Jamie puts those together for me. What do you call those, Jamie?
Oh, just the PC forms.
The PC
Yeah.
forms it's kind of a documentation of each phone call. You guys are getting those. And then last call, I had a note that you want me to forward those to Julie so she can do the reporting to UNL.
Yeah, that was the next challenge we ran into. Is Julie asked us if we were putting that information into the system, and we're like,
Uh-huh.
we have no idea what we're what we're doing at this point. So she said, yes, send them to
Okay.
me, and she goes, I'll put them in for you guys until we get you up and going. And she
We
says,
get
it's
going,
not that
okay.
difficult to get someone trained like Amber or Jordan in the PC model to upload that information. So that really needs to be on our list, Amber, to learn what that system is. Julie says it's really easy, and we just need to figure out what that is so that we can start inputting. So right now, yes, you're sending those forms still to Julie to
Okay.
input the numbers for the efficacy of the program, and then the invoices to us. So it is still
Perfect.
very clunky.
So our missing links are right now is that the personal information on that third family that Amber needs. And then the contract, we just need to see if we ever had one, got one finalized, signed. I
If
felt
you-
like there was one because I had made 2 folders, one for PC and one for coach, because to me they're 2 separate programs, and I thought I was gonna go in and print that stuff and put it in there. But if you don't think there is one, maybe I was mixing it up with.
I don't know that I've ever even seen a PC contract. Do you have a contract for PC with Hall County?
We do.
Okay, maybe we did. I'm sorry, Carla. I'll have to go back.
It's
and
all
look.
right. I'll check on my end too, because I was pretty sure, I feel like I didn't sign the coaching one because it wasn't quite finished, but I was pretty sure we signed the PC one.
Okay,
Oh, okay.
I'll look through my emails too, because we could have done that real quick and then tried to figure out what to do with coaching. So
Okay.
I'll look on my end
right.
also. Amber, did we catch all your questions?
I don't want to backtrack too much, but I fully understand like coaching, like what coaching is and everything. And I have a foggy understanding of the parent connector program. So what is the distinct difference between the two?
I'm going to let Jamie tackle that because she's the pro at that. So, Jamie, go for it.
I think the biggest difference between the two is the coaching. The coaching is case management. So it really is, here's the problem, here's the solution. Here's the problem, here's the solution. Whereas with the PC model, it's a phone-based service. It's evidence-based. It's peer supported, so it's peer-to-peer. And it really is based around improving skills and outcomes for families who have kids with educational or mental health needs. So it is more of a behavioral health type support rather than maybe more case managing, social service kind of support. So yeah, a lot of what we talk about with PC, I mean, we do some of the same stuff. So that's kind of why it gets confusing. You know, if a family needs food, we're going to point them in the direction to get some resources for some food. If they need budgeting support, I'm going to support them with that. But we're also going to talk about self-care and make sure the parent is taking care of their own needs and make sure that they're communicating with the school and that they're feeling like they have a voice at school and role play those kind of situations that they're struggling with to, you know, help them better support their kiddo in those situations. So I think that's probably the biggest difference. There's the mental health and behavioral health component to PC that's not necessarily in coaching.
Thanks, Jamie. The only thing I would add to that, Jamie does an amazing job with that, is who the referral source is might also clarify. The referral for the coaching program would always come from you guys to us, right? No one else is going to refer someone for coaching service other than your navigator, right? The PC program, the school might refer them. Buffalo County Diversion might refer them. A therapist might, you know what I'm saying? There's a variety of referral sources with the PC program, where the coaching program, it would simply be your central navigator making those referrals, if that helps too.
And there's no, I guess, a big piece of PC too is there's no funding associated with that to give to families. And it's only on the phone. So there's no face-to-face. There's not a lot of, there's no collaborating with other system partners. It is just me talking with the parent, and it's a one-way phone call. So the parent can text me and say, hey, I can't meet with you. What day can we meet? But it's not like a crisis service or that kind of thing. It's a skill building service. So.
And
Does that-
Amber, I was just going to throw out too that PC is an intervention. And when you think about programs and interventions, PC is the intervention. So when you think about the coaching and the forms that Carla filled out, that question number 7 is a spot for every intervention. So yes, they want additional assistance in budgeting, then your money matters. That's an intervention. When they ask for additional support for parenting programs, Circle of Security, intervention, another parenting program. So it's the curriculum that has evidence-based to it that shows that by doing XYZ of this program, it has efficacy and it will create change for that family. So the coaching is more of that relationship building and better understanding, kind of evaluating where the family is and then helping them get connected to those interventions.
Well, and even the person doing the coaching, say it was Compass and they captured that there's a mental health need, they could refer to the PC program as an intervention. So they could cross-refer. The other big difference is length of service on this, because we have PC families that have worked with us for a year and a half, some of them, where the coaching is a 90-day program. Basically get them what they need, get their resources, refer them to those other preventative programs, right? But that's another big difference in the two programs in my mind is the length of service that they'll be staying in the program.
Right, we all answered your question, Amber. More confusion or better?
No, so much better as that fogginess, the clouds have gone. And I understand completely. So thank you. That's where I just like I knew generally they both were like helping to like reach a goal that they have, but I just didn't know how is it different. So that made a lot of sense when Jamie said that one is more like that case management kind of like
Yeah.
resources, and then the other one is just like the peer support and behavioral health. So that yes,
Awesome.
I'm on the right page now.
I hope my email.
Before I was in a different book, it was not good.
When I emailed this morning, it just occurred to me that maybe there was some fogginess there. And it is honestly, when I first started at Families Care and we started adding different programs because different funders want to pay for different things, it was confusing to me. I'd have to make little cheat sheets about each program. And when a family just calls our phone number, which program do I plug them into? And which need would they be met best in? So I know it gets super confusing when there's multiple programs. So.
Well, and it didn't help that both of the initials are like PC, you know, like parent coaching, parent connectors. And I was like, but yeah.
Yeah, that's true.
So thank you so much. I really understand now.
If I ever type you an email about them, I put coach all in capitals for myself. That's how I always write it. And I put PC as just PC. That's how I sort it in my mind to differentiate.
So Carla, do you feel like you have all the tools from Hall County for the coaching piece?
Oh, absolutely.
Once we
Yeah,
get that,
once we get our
okay.
Yeah, once we get our contract going signed, and if you guys have referrals, we are set to go using those same tools as long as you're good with the tools there. So
It sounds like a lot of this is happening at the housing meeting, and I think both you and Jamie have been on those housing meetings. So most often that conversation looks like Jubilee saying, I put somebody in a hotel room, they've been there 3 days, they have 3 children, I'm very concerned, what do we do next? And so we've just been referring to Compass, but we're ready to start referring to you guys too. We just wanted to make sure that we had that initial payment set for you guys so that we knew both had expectations on that. So I don't know if you usually come to that meeting, don't you, Jamie?
No, I don't know what meeting you're.
I know I was going to ask you, is that the Community Connections meeting or which one is it?
No, that's the housing meeting that that Tessa and Wanda co-lead. It's every Wednesday at 2. Am I right, Amber?
Oh no. Yes,
so
2. It's at 2. It's at 2.
It's the.
No, we'd love an invite. One of us will make sure to attend.
Okay, we'll make sure and add both of you to that list so you can pick and
Perfect.
choose who can go. And so that's usually when we are talking about some of the cases, we use initials, like on that CRT form that you guys filled out for those families. We'll use those initials on that form. Also ask the families if it's okay if they approve for all of us to work together to support them. So if we have those signed CRT forms, then as a partner, we can have that conversation with their initials. And so we'll just probably the first hour, everybody shares kind of where you're at with an agency. So, I mean, you could share that you have these new services, that you're on board now with coaching. You also have PC and, you know, what other programs you could bring to the table, your money, your matters, those types of things during agency share in the first hour. And then we dig into cases after that. They also are doing some pretty big vision pieces like affordable housing and building housing. So there's some of those conversations too about how do we break this reoccurrence of coming back and asking for rent every week. How do we keep moving forward into helping our families, our community learn from those that we're serving? And that was kind of my questions to Julie. How do we know that those families are asking for additional assistance? What are they asking for and they're not getting because we don't have it offered in the community? Or what do they wish they had? That information in my mind on that form is beautiful. You know, how do we capture that and share that with others? Because that helps us frame juvenile justice funding. You know, we could be funneling more dollars in for that. And just my mind goes wild with all the different things we could be doing there. And I think Jamie was headed the same way.
Yeah. Well, and I do think that Julie's forms are conducive to sharing that during that summary portion on the monthly billing, especially the first month. That could be captured really well.
Yeah. Well, any other questions for us to get this wrapped
No,
up?
thanks for
Okay,
taking this few
Colin?
minutes. I just want to make sure you guys had, we were all on the same page, and I had a foggy about the contract. So thanks for clarifying that.
I actually do, completely unrelated to PC and coaching, but Denise, I was wondering, we have a Parent Leadership Academy where we have trained parent leaders to participate local, regional, and state to kind of lend family voice and family choice to different committees and things like that. And so, you know, I love all of the things that Buffalo County is doing. And I just wondered if there was a place for parent leaders in some of the groups and stuff that you have, and if we could maybe plug some of our parents in and get some work going for them.
Yes, I love that, Jamie. Gosh, where do we want to take that next?
All of the parents that we have trained so far, correct me if I'm wrong, Carla, I think are going to be parents with lived experience raising kiddos with mental and behavioral health challenges.
Yes.
So,
yes.
You know, some of them might have their own mental health too that they've worked through, but really they've come to us through family peer support. I think that is something that might change as we grow and evolve, but there's, what would you say, Carla, 50 trained parents? Is that kind of what we're thinking?
Statewide, yeah.
Statewide. So, and they have gone through quite a training. Carla and several others developed this parent leadership training to kind of teach parents how to use their voice effectively in these different areas to affect change, system change and things like that. So kind of an exciting next step for this project that we've been working on with SAMHSA, the systems of care, over the last several years.
Do you think it would be best to invite others to meet with your parent leaders, just to get to know them and kind of know the areas that they would have a passion for, and get them connected to other groups? Or do we prepare a list of what the groups are in the community for them to plug into? I'm not sure which way to go first.
We're kind of at the front end of that too, Denise, where we have these people we've trained, and kind of what's happened is what I didn't want to see happen when we started developing this several years ago was the parents have committed this time. It's back when it was face-to-face, it was an entire weekend. Now on Zoom, it's 5 weeks for 2 hours. So they're committing this length of time to go through the initial level 101 training, which covers a multitude of topics like ethics, confidentiality, all of that stuff. And then they've got their training, they get their certificate, and then we kind of drop a ball. Basically, we're equipping them, but we're not giving them any options in which to use those skills. So I think our hope was that we could create a forum where they could go, whether it's a social platform for that closed group that says, here's some opportunities that we've heard about, like Region 3 would like a parent voice on their advisory board, or Families Care needs a parent voice on, you know what I'm saying? And so we'd love to add you guys to the list. That's kind of where we're starting, is finding out what opportunities we actually have available. And then I guess if, say, an entity like, say, you guys decide, yeah, we'd really like to meet a few of your parents, then we could find parents that were interested in that type of opportunity to share their voice at the county level. Because some people might want that statewide level where they're going down to Lincoln and speaking up with legislative, you know what I'm saying? There's different levels of involvement people want. So did that answer the question?
Yeah, it does a little bit. It just seems like if somebody just had a few minutes that would be able to pull together your parents on a Zoom call, and then reach out to that list that you're already preparing of Region 3, us, you know, and a few others that could just do quick little 10-minute commercials. This is what we're doing. Would you like to join us? It's kind of like,
That's a great idea.
Community, we would love you. We'll accept you with open arms. Accept's not the right word. We're here with open arms. We welcome your input. You're a very valuable part of our community. help us better understand your world and how we can be better connected, and give them the option then to kind of plug in where they want to. I think it's just hard to give them a list because
Uh-huh.
there's just so much more dynamic in meeting, you know, I'm going to say a Wanda and talk about opioid prevention.
Right. No, I love that idea, Denise, because
Me
what
too.
we really want to embrace and affirm these people that have committed to this. And I think then the face-to-face and then hearing, like, say there was 12 of us on here and you could talk a little bit about your role, and they might have a better fit if they could actually hear about each agency and connect with the people involved a little bit. So we're right at the ground floor of this, like Jamie said. I mean, we're just starting to move in this direction. So this is good input.
I love it. I'm even thinking the Safe Center would love to have
Oh, yeah.
some
That's a great idea.
input
Thank
there
you.
too.
Well, and I think if we can get them connected, I think that's how the movement's going to grow. That'll be, you know, it's not a lot to do when they've been trained and there's nothing there. So I'm excited to see them get plugged in and see them, because then the other parents can tell those that are getting trained, this is what I get to participate in now. This is how I'm contributing again, you know, just moving forward. So we do meet on a regular basis. So maybe Carla, that's a next step we could.
Oh, maybe to the parent leadership meeting.
Yeah, set up some
Leadership
sort
committee that meets at night, though, because some of the parents
of-
have
yeah.
different jobs during the day. So we have a monthly meeting. I think it's the third Thursday at 7. And that's like our core parent leadership team. And those are the trainers that have gone through level 1, level 2, and train the trainer pretty much. So they're the ones equipping the next parents coming in. So that might be a good opportunity. We've kind of tasked all of them with doing what Jamie just did and asking more regional people if they'd like to be involved, because we have people in Omaha, in North Platte, in Lincoln that are doing the same thing Jamie and I are doing. So that's kind of where it's headed.
And Jamie, I think it would be very appropriate too at the next housing meeting to say this is a group that that are available to plug in, and ask if there's any other organizations that would want to be on that list to be invited to meet
Oh,
them,
nice.
or, you know, something like that, kind of like a graduation. How do we get plugged into the community? Here's all the different boards and committees that are available out there. I liken it a little bit to Leadership Kearney, but with so much more meaning and engagement.
Yeah. Well, and I think family voice is really just something that's growing in understanding of the need for different agencies and organizations to need that, to have someone to say, this is my experience and this is how we can take that and run with it. So it's just kind of an exciting next step. So
yeah, you got a believer in me. The other group that I would love to see is the new brain injury, Nebraska Brain. They're in Kearney, and I was on the board to start with, but the injured brain piece I think would be really neat to have them plug in on their board, and they're just kind of getting up and going, because a lot of those parents, I would imagine, have experience with the concussions or other brain injuries that have also been the root of some of the issues that they've seen as a family.
yeah.
Right. I know on our leadership team, we have a couple of parents that have children with complex needs, like developmental disabilities, along with behavioral health challenges. So
Yeah, like EDN and our early childhood stuff would be so fun to get them plugged in there. Yeah, I love it. Thank you, Jamie.
Absolutely.
thank you for all the good ideas too.
Yes, I've got a list going. So
All right. You guys are amazing. We really respect you guys and all you do. And thanks for pulling us in and letting us be part of it. So
Well,
Yes.
thank you. We knew someday we would figure out how we could all work better. I don't know if that's the right word. More closer together, more aligned. And we're seeing that.
it's
Too bad a
exciting.
pandemic made us see that, but
I know.
Right.
Good things can come out of things.
it can. Well, thank you all,
Thank
and
you.
have a great Tuesday.
You
You
too.
too.
Thanks,
Thanks, guys.
everyone. Appreciate it.
Bye-bye.
Bye-bye.